Hello everyone, this is Dr. Erdogan by Smile Hair Clinic. Today I would like to share one of our patients that we did his transplantation in 2024. Let's start with his photos first to evaluation. Every time with the patients we wanted to see the evaluation photos that is sent from their country, their home to us, because it's sometimes different when we check the patient in the clinic. So let's check his photos that he sent to us. As you see from the top of his head and the donor area, it has a diffuse thinning. Plus, it's not like a very androgenetic alopecia that we see usually with the patients. Mostly in the 90% of the whole patients, we see the male pattern baldness, which is affected by the hairline, temporal recession. Then we see the same time the crown area receding part. But in this patient, as you see, the frontal part, he have some remaining grafts, remaining hairs in the front, but just behind in the mid-scalp, we are seeing a total bald area, which is affected by many other things. In my doctor notes, when he was in the clinic, I noticed that when we are doing the incisions, we are able to understand his circulation because we are doing the incisions and the bleeding shows us how is the circulation of that area. So in my notes, I noticed that, and because when we examined the patient, we also noticed that the circulation of that area was not too great. You can see also in the progress photos that it is a little bit delayed with the progress, and after that he just see some growing in the mid-scalp. In his condition, in the donor area, as you see, there is some baldness, not baldness, but some lower density appearance, which maybe ended up with lower area, lower extraction possibility. We are glad we did 4,350 grafts, which is over the average and which is a good number for covering most of the areas. So let's check his photos in the clinic and let's see our plan. So here you can see that we already used his hairline. I mean, with this kind of patients, he has already some hairs in the front. We do not want to change it. We always wanted to stay in the same line. Also, we want to include those hairs in the line to have a more natural look. Yes, we are doing very natural results. Within maybe 10-15 years, we are doing great things, but still, it could not be like the natural hairs of itself. So that's the reason we wanted to include always the hairs inside the line, and also every time we want to be conservative to give more coverage to patients' other areas. You see that it's just above his hairs, his already hairs, so we wanted to plan and do the implantation on the both temple part. Just behind we have a large area to cover, and in the same time there is a very large crown area actually. Normally with this patient, he needs a second surgery in the future, but this is very, I think it's not very objective with most of the patients, because sometimes patients are too happy with the outcome of the front, the mid-scalp. Sometimes they don't care about the crown. Sometimes they want to have more implantation in the crown. So it's very patient-oriented decision to come for the second surgery. But I mean, as a mathematic and as a calculation, as a planning, this patient needs a 2 surgery session, because the frontal part needs at least 3,000 to 3,500, and something he needs at least 2,000 for over 2,000 for the crown area too. So let's check his implantation photos, what we did to him. Okay, so the front, as you see, we focused on more the temporal areas. We increased the density, we fortified the frontal part. We are more focused on the mid-scalp, and with the remaining grafts, we try to focus on the crown area too. Let's check his first month photos. I think these are the very important parts I try to mention in my videos about what is patient's expectation about their progress. In the first month, we always see that the patient loses most of the hairs that it's transplanted, and also his natural hairs, his existing hairs start to grow at that time, nearly 1 centimeter amount. So in this period, he has some long hair, which is not very noticeable because patients' concern, I think, always are it's noticeable or not. So with this patient, I can show you his 1 month, and you can decide yourself about it is very noticeable or not. I think every patient is different for sure, but according to my experience with talking with the patients, it's always having the concern within the first 3 or 4 months. You see, for example, in the mid scalp we are seeing the hairs totally gone, because it's probably due to the circulation of that area. The donor area is healed already. It looks good. I think 3-month evaluation, 3-month progress could also give us some more details about, because in the 3rd month photo you can see that the mid scalp seems little, not little, I mean almost nothing growing. In the temple part it started to grow, but it is a little bit delayed. Maybe patient could be very stressed, very concerned in that time, but luckily, I mean, it is growing. We saw that, it's good. But if not, minoxidil or another improving dilation or circulation augmentation will be very needed for these kind of patients, or PRP is also very helpful too. This is crown. Even crown is started to grow, which is very good. This is the donor area. It's not too much noticeable. I mean, it's still in a recovery period, but it looks very good, I think. Okay, let's see 6 months. I think most of the time with some patients we are seeing very, very good results, very reliable, very satisfying results for the patients. So I think even now he has a very good frontal appearance. I mean, the density is too great, I think. Probably he's too happy at that time. People are giving their compliments to these kind of hairstyles or hair if they know from him before. The mid scalp is very, very grown, but still you can see that it is not equal with the frontal or other parts growing. Let's see his 9th month photo. Okay, so here, as you see, it is a little better. Because it was very good in the 6th month, but now I think it is very natural with the frontal hairline. You can see it's not very straight. There are macro and micro zigzags. We already used the existing hairs too. So I think it's not very noticeable if someone look at him in very close or very far distance. They can't not understand that he has the hair transplantation, which is the natural way. I mean, if someone, when he's spotting at you and is looking at you and couldn't understand that you had a transplantation, I think that's the most natural one. We wanted to every time do the same thing for all patients. The sides growing, it looks good. From this side also, I mean, sometimes the front is very important, but whatever the people see from the side, it's also very noticeable to understand that he has a hair transplantation. But I think it looks very good. It's little upper in the temporal part, which is according to his age. They are two different guys. I think he was also handsome, but he's much more younger and a better appearance right now. So thank you for watching us. It was nice to see these kind of patients result, because we are also very proud of if the patient is happy, is sharing and also giving permission to explain these kind of things to you, so you can also able to understand what is the result, how was it, and how is it right now. So thank you for watching us, and if you have still questions, please write on the comments. We would like to answer them. Thank you.